60 Minutes Overtime.
This week on 60 Minutes, we visit Novo Nordisk, the Danish pharmaceutical company that manufactures Ozempic and Wegovy, and we look at what the impact of that success has been on Denmark. They have produced a wonder drug, an anti-obesity drug that's completely transformed their economy. Novo Nordisk isn't just this wildly successful unicorn company, but at some level, they now represent Denmark. Doesn't happen to be. We talked to Mats Krogsgaard, who's the CEO of the Novo Nordisk Foundation, the nonprofit that's in charge of distributing all of this profit. Is there a sense that you're not just representing a company, you're representing a country?
In some ways, we liaise more than we've done ever before with politicians, ministers. We hope there'll come more companies like Novo Nordisk, but for the time being, it is the Novo Nordisk company that is driving a lot of, you can say, the wealth of the country.
The idea that both good acts and less good acts reflect not just on a company, but on a country. How does that inform decision making?
The more you become well known and the more you become a significant player in a country's economy, the more you also have to make sure that you're not kind of misbehaving, or that there's a lot of focus on what you do and the way you do it, and also the commitment that you give to society. So we are working closely to see, can we make sure that the Danish ecosystem is actually benefiting from what's happening and while not draining resources from other parts? It's hard to exaggerate the impact of Novo Nordisk and of Ozempic and Wegovy on the Danish economy. But for Novo Nordisk, Denmark would be in a recession. The market cap of Novo Nordisk is about $500 billion. That's more than the GDP of all of Denmark. And so when the company is doing well, that trickles down to the rest of the economy. As you see it, what is Denmark's response to the recent runaway success of this company? Denmark is responding in a way where people realize, including politicians, that it's good for the Danish economy. It's also good for the workforce. I mean, just last year, Novo Nordisk would have recruited like 10,000 new colleagues or so, which is a lot in a small country. We as a foundation can contribute more to society. The Novo family is the strongest contributor in terms of tax payment and so on to the Danish society. The risk here is that this is one sector.
And when it comes to mobile phones, Finland, where almost everybody speaks English.
And about 25 years ago, ironically enough, the producer on this story, Michael Gavstron, did a piece on Nokia in Finland. And you had this upstart, this cellular phone company, completely transform this Finnish economy.
Do you ever feel that you're in the vanguard of a revolution?
I think we have seen the first part of it. There's more to come.
When Jorma Olja took over as Nokia's chief executive in 1992, the company's best-known products were toilet paper and rubber boots. Olja flushed all that away, concentrated on mobile phones, and became the world's largest producer with 25% of the global market.
Are you ever staggered by how much Nokia has done in such a short time?
I could not have thought about it in 1992 when I took over as CEO. I think we have been somewhat taken by surprise.
At its peak in 2000, Nokia accounted for about 4% of Finland's GDP and was dominating the global cell phone market. But the launch of the iPhone changed everything. Apple and Google elbowed Nokia out with innovative smartphones. Nokia's downfall resulted in the loss of tens of thousands of jobs in Finland.
And there is this risk in Denmark now with Novo Nordisk. What happens to drugs? Other suppliers and manufacturers come along and try to undercut you on prices. Generics enter the market. There can be litigation. There can be supply chain issues. There are all sorts of potential impediments that might stop or at least at some level curtail this growth. This is a diversified economy. This is a country with a safety net. This is a country with a high tax rate. I mean, it's not quite as perilous as it might be elsewhere, but there are dangers that come with having one sector be so dependent for so much growth. We heard a lot of high-minded, ambitious talk. Does Novo Nordisk think it's going to change the world with these anti-obesity drugs?
I think so. It's not a slimming drug. It's a drug for people with a big problem, with a big disease.
We spoke to Hannah Sindbæk, who's an independent journalist in Denmark, who is rightfully fascinated by Novo Nordisk. As this drug gets cheaper and cheaper as drugs do, and as perhaps U.S. insurers start to subsidize this, tens of millions of Americans are going to be eligible. What is that going to do to this company?
Well, it's going to make it very, very rich. But there might be competitors coming out of the woodworks here and there that can make these products. But they were the first and they're the biggest. Of course, they got a very good chance of leadership in that field.
So many people could benefit from this drug, but so
Yeah.
many people can't afford it right
Yeah,
now.
that would be something they would be worried about and thinking about. Can we do anything about it?
You think those are the conversations happening
Yeah.
in that
Yeah.
building right
Yeah.
now?